I am going to get us started in respect for everyone's time to make sure that we can get all of our good questions in and make sure that everyone has a chance to ask questions during our Q&A. So to start us off, welcome everyone. Thank you so much. Before we begin, I'd like to share some critical statistics about maternal mortality in the United States. The United States has the highest maternal mortality rate among developed countries. In 2021, about 33 mothers died for every 100,000 babies born in the United States. Black women are nearly 3 times more likely to die from pregnancy-related causes than white women, and about 84% of pregnancy-related deaths are considered preventable, according to CDC research. These stats are why we're here today to have this important conversation around maternal mortality and the efforts to combat it. My name is Faith Boone. Welcome to OHCEngage. Our guests today are Charles Johnson, the founder of 4Kira4Moms, and Gabrielle, Gabby, as I will call her, Gabby Albert, the executive director. 4Kira4Moms is a nonprofit organization dedicated to advocating for improved maternal health policies and practices in honor of Charles's late wife, Kira Johnson. There will be a Q&A portion at the end of our interview, so please send your questions in through the chat, and we'll make sure to pick those up and get them to Charles and Gabby at the end of the interview. Charles and Gabby, thank you so much for being with us today. I hope you guys are ready to jump in because we're going to get right to it. So first, the statistics I shared underscore the urgency of addressing maternal health in our country. So first, Charles, I want to ask you, can you tell us about your personal experience that led you to establish 4Kira4Moms and what the organization's primary mission is?
Sure, of course. So first and foremost, just thank you. It's great to be here with you. It's always good to be here with Gabby, our fearless leader. And thank you for everybody who's joined us. Thank you for the team who helped put this together. So as you mentioned, I founded an organization called 4Kira4Moms. I never saw this as the path for my life, but I was fortunate enough, Faith, to meet a woman that changed my life. And so we talk about Kira. Those of you who may have heard me speak, I can brag on her all day long. We're talking about a woman that, you know, was sunshine personified, flew planes, raced cars, ran marathons, spoke 5 languages, and I always wanted to be a dad. And so on April 12th of 2016, we walked into Cedars-Sinai Hospital in Los Angeles for what we hoped and we really truly believed would be the happiest day of our lives. And we ended up walking into a nightmare. Kira, throughout her pregnancy, was perfectly healthy. And all signs pointed to our baby being healthy as well. We went in for what was supposed to be a routine cesarean at our doctor's recommendation. Son was born perfect as we anticipated, but shortly after that, they took her back to recovery, and that's where I began to notice things taking a turn for the worse. In the interest of time, I'll spare you a lot of the very gory details of what happened, but over the next 10 hours, Kira was allowed to bleed internally while myself and my family begged and pled with the staff at Cedars to do something. I was the one that actually recognized blood in her catheter, and for 10 hours we begged and pleaded, and for 10 hours our cries for help fell on deaf ears. Ultimately, we went in at 2 o'clock for the delivery. It wasn't until after midnight that they finally did something. They finally took her back for surgery. And by that time, it was far too late. And so they operated on her, but they were unable to save her. What I didn't understand at the time, Faith, but what I understand, and I know a lot of people joining us here today understand, is that we're in the midst of a maternal mortality crisis in our country. When I walked in that hospital that day, the thought that my wife would not walk out to raise her kids had never crossed my mind. But as the days turned into weeks, I began to hear stories of other families that had had horrific birthing experiences. And I started doing the research for myself, and I came like, oh my God. And I was shocked by 2 things, Faith. And I know we're going to get into this in the discussion. One, how is this happening? And how is that everybody's outraged about this? And so I began to share Kira's story publicly in 2017, and her story, along with the stories of other mothers that have made the ultimate sacrifice, giving the gift of life, have become the catalyst to what I call the maternal health revolution. And so we founded this organization with one very clear goal, and that is to eradicate the maternal mortality crisis in the United States, period, full stop. And we'll talk about how we plan to do that in the programs and our approach and our philosophy. But the good news is I want to level set this conversation. Although these stories are difficult, they're heart-wrenching, and every single one of these mothers that we have lost deserve to be here. The good news is we can fix it. And that's why it's an honor to be here with you in this community to talk about it, just that, how we are going to fix this.
Charles, thank you so much for sharing your story with us. My heart goes out to you and your family, of course, and it's just it's amazing to see what you have put together with your organization. I'm really excited to hear from you, Gabby. I know that you, as an executive director, you're coming on fairly new to the 4Kira4Moms organization. So we'd love to hear a little bit about your background and how you tie into the mission of 4Kira4Moms.
Yep, thank you, Faith. So unlike Charles, where the work chose him, I did choose this work. And the reason that I chose this work is Charles and I have been friends since our first week in college. And his story was actually the third story that I learned of this crisis here in the US. So about 6 months prior to Charles's story, one of my sorority sisters, 3 weeks due. She lived in Plantation, Florida, and was a clean bill of health, goes to the hospital because she wasn't feeling well at the urgency of her doctor, and no one saw her for 3 hours. And after 3 hours, when they finally hooked her up, she had emergency C-section. She went into a coma, her uterus shredded, and she had a stillborn. When I got to the hospital, to find out what was going on and saw her husband, I couldn't understand how that happened. Then about 6 months, 5-6 months later, right before Charles' situation, another one of my best friends who lived in Charlotte, North Carolina, she had a C-section, routine scheduled for a second son. And the week after, she just complained of headaches every day and wasn't feeling well. And so a week to the date of her C-section, she took the ambulance to the regional hospital in Charlotte. Her blood pressure had skyrocketed, which we know is preeclampsia. They gave her, meds, got it down. Her husband goes to get the discharge papers. And when he came back, he watched her stroke out. She was then airlifted to the downtown major hospital in Charlotte, open brain surgery. And now she suffers seizures for the rest of her life. And then Charles' situation. And in the midst of all of those situations where I was blessed to be a support system and help both of my friends out the hospital, I got calls from lots of other people saying, hey, I almost died, this almost happened. And in the last, 8 years, I'd say about 70% of my friends have all had a form of a complication, a near miss, lost a child, or in Charles' situation, lost his wife. And so to me, it just became something personal that I wanted to support. When I moved here to Atlanta, I was working at Kimberly-Clark, the maker of Huggies. And, I called Charles, said, hey, what can I do? And I was really trying to make that this overall platform for the company in terms of social justice campaign. Brought Charles on, we got a little bit of sponsorship, but it never really, really stuck. And when I decided to leave corporate at the end of last year, I had the unique opportunity in which I was already a board member for 4Kira4Moms for about the past probably 2 to 3 years. But there was a opportunity at Harvard Business School for a first ever social justice cohort. I was going with another organization where I was currently president of the board. Charles was available and I said, hey, let's bring 4Kira4Moms. We can represent both. And coming out of that with free time and figure out what I wanted to do with my life, God told me what I had to do with my life. And that was to take my talents that I developed for the past 20 years at Fortune 500, Fortune 50 companies and dedicate it to something that actually matters. As a aunt and godmother, I'll never have the traditional legacy. And so recognizing that I could be a part of something to solve a crisis that makes absolutely no sense. I volunteered for a few months and then Charles and I looked at each other and said, how can we make this happen long term? And so I decided to come on board as the official executive director in this past year. And the reason why is 84% of maternal deaths in the United States are preventable. That is the dream of any CEO in this country. Why? Because it means we know how to solve the problem. So for me, knowing that we can solve this, I wanted to be on the right side of history and to do something meaningful so that when I look at all of my nieces, nephews, my godkids, everybody else, to know that it will be easier for them, that when they go to have children, for my great nieces, my great grandkids, all of that, because step right, like I'm everybody's auntie, that they won't have to face this. And so that's why I decided to join in these efforts and to make a difference.
Thank you so much, Gabby, for sharing that. Your advocacy is the energy that you have behind it. It definitely shows, and it's really interesting to hear the personal stories that both of you have experienced. And Gabby, something you said about the fact that we know that this is an area issue that can be solved. That makes me want to ask you, Charles, what progress have you seen with your organization, 4Kira4Moms? If we know that this can be solved, what are the crucial steps that need to be taken now to make sure that we continue to move forward and get to that point of eradicating this issue?
Yeah, so I'll do my best to be concise, but I think the biggest thing that we've seen is a tremendous shift in awareness, right? And I think one of the reasons that this was able to take place for so long is this is America's dirty little secret. Like even today, still, when you have the conversation about what the statistics are, where we rank nationally, and then even diving a little bit deeper about how the racial disparities show up, right? People are shocked and they kind of give you this look, but still, when we talk about where we are now in the general consciousness of the country versus where we were 8 years ago, there's that. I think that what we are seeing now is a tremendous progress across a lot of, let's call them sectors, right? From grassroots, right? Meaning the community organizations that have traditionally been underfunded, under-resources are now getting the attention and the resources they need, whether it's from private funding, institutional support, or governmental access to funding and grants, night and day, right? We've literally seen, probably, well over hundreds of millions of dollars, if not billions of dollars, flow into the space. So being properly resourced is huge. And I also think there is, from a legislative standpoint, there are things that we've made tremendous progress on that we're extremely proud of. On the state level, we've worked to pass groundbreaking legislation like the California Omnibus, which does a lot of things, including making it a requirement for every hospital in the state of California that delivers or catches babies to have mandatory implicit bias and racial sensitivity training, to expanding postpartum Medicare and Medicaid to a year postpartum. In 2021, I think there were only 6 states that had postpartum care up to a year. And now I think we're at 46 as of January of this year, which is huge, right? And so access to care. And then from a legislative standpoint, in 2017, we passed the first ever piece of federal legislation. I had the opportunity to testify before Congress in support of the Preventing Maternal Deaths Act. And that was the first one. Currently, we have a package of 13 different bills called the Black Maternal Health Omnibus, and we can talk about that a little bit later, and happy to delve into that in the Q&A. But so across the spectrum, from grassroots to even when we talk about corporate responsibility, the way that corporations are showing up, right? It's an example I can give you off the top of my head. Walmart has made doula care accessible for every single one of their employees in the United States, right? Walmart births more babies than any employer. There's some stat, and I wish I had it, I need to go back and get it, but there's some stat around how often in the United States a Walmart baby is born, meaning like a Walmart born to an employee of Walmart. It's staggering, right? So them making that step is huge. So I'm really proud of what we have accomplished. And when I say we, that's every single person that has had a hand in this, but we still have a long way to go.
Definitely. Thank you, Charles. And I love that you were able to talk about those policies and those pieces of legislation that you guys have worked towards. I feel like we're probably supposed to be getting to this later on, but I just want to know, what were the steps that you took to get 4Kira4Moms involved with those pieces of legislation? I want to know how other people could get involved with that. How can, like people like me, like I would love to show my support for maternal mortality and to get rid of it. I don't know what I need to do that. So how did you guys move forward to be involved in that legislation? And then what can normal, everyday people do? Not that you guys aren't normal everyday people, but what can people like me do?
Gabby, you want to take that or you want me to take it?
Well, I can tell you how everybody can get involved, right? I mean, there are so many organizations like ourselves, but it's just educating and being aware and contacting your local congressmen and congresswomen. The reality is everything in this country, it starts at the legislative level because they work for us, but they only work for us when we tell them what we need and what we want. And so there are lots of local bills or national bills that need to be passed, like the Momnibus, as well as the Dads Matter Act. And so showing your support when there are letter campaigns, we can put up, I think, what our letter campaign is that we still have open. You can sign that. You can come to our website. And it's really just showing your support. But then it's also in your own village, in your own circle. It really does take a village. And it's not just to raise a child. To actually have and give birth to a child actually takes a village. And so when members of your village are pregnant, making sure that they are aware of the worst case and then prepared for the best case. And so are they up and understand what doulas are, right? One of my little things is we see everybody today during pregnancy have these lavish baby showers and these lavish photo shoots. The cost of those photo shoots and the cost of those baby showers are the cost of a doula, which means you have an advocate in the room to help you through the process. It can also give you a night nurse that will help you ongoing with your children as you're raising them. But those are the things that we need to get better in our community and talk about it. So when somebody is pregnant in your community, it's making sure that they have the resources that you can, hey, you know what, go to 4Kira4Moms, they have information. Check and see if there are local clinics available that have midwifery or doulas and share with them, buy those services for them. It's $1,500 to $2,500 for a doula and or a midwife. So again, when you're throwing these lavish showers, it's well within that range. And if you plan out a pregnancy early enough, you can prepare for those expenses down the line. And then also making sure that the father is involved too, and that they have somebody to talk to and that they're prepared for pregnancy as well. Because in that room, everybody always talks about self-advocacy, but we need to make sure that mothers have outside advocacy because they're gonna be in pain and they're giving birth. So how do we help reduce that responsibility? By making ourselves educated and aware.
Thank you, Gabby. That's awesome. And I definitely have a little bit more idea of what I can do now. And I hope that others in the room that are here to listen have a better idea of what they can do to get involved as well. I want to piggyback off of what you were talking about community and making sure that people in your community know what they can do. And so I wanted to know community initiatives. Are you guys working on any, aside from legislation or policies or anything like that, are you guys working on any community initiatives that individuals can get involved in that are through 4Kira4Moms? Or are there any other top priorities that you guys are thinking about focusing on?
So my goodness, so I want to answer that, but I just have to take kind of just a moment really quickly. I really want to, I know I see a lot of you all chiming in the chat. Please, I want to encourage you all to use the chat. And we're going to definitely pull from the Q&A. I have to give a huge shout out. I see Denise Bolds is just an amazing, one of my sheroes who's in the community doing amazing work with her group, training doulas in the New York area. And I'm not sure she knows, she actually came to the rescue and supported a family a couple of weeks ago for us that was in distress in the New York area hospital. So Denise, I love you to life. I have to shout out to people that are on the front lines doing the work because this progress would not be possible without them. With that being said, community-based initiatives are so critically important. Community-based organizations are so critically important. women-led community-based organizations are so incredibly important. Let me take that a step further. Black women-led organizations are so incredibly important. So for me, one of the things that we're doing to make sure that the support is there and that these organizations are properly resourced. Some of you all may or may not be familiar with the way that federal funding typically works, and one of the snafus is typically when the federal government passes large spending bills, particularly that are supposed to go to health and human services organizations to improve the quality of life, close healthcare deficits, address systemic problems in healthcare. One of the challenges is oftentimes this funding is outside of the reach of those small community-based organizations, right? There are requirements, sometimes, and just be real, by design, that make it hard for them to access the funds. So what happens is that large part of money goes to large organizations that aren't on the front lines, that aren't in touch with the community, that don't have their hands on bellies. You understand what I'm saying? They're not squeezing hands in delivery rooms. And then they make those other small organizations tap dance to get access to those resources while they manage the resources. Now, let me say, there's some organizations that are out there that are large, that have been doing great work for organizations. With that being said, it's important for us, and we've made it a priority to make sure that the legislative initiatives, the funding packages that we're pushing for the government to support are earmarked specifically for community-based organizations. And so we can share
Uh-oh. Okay, I can't hear you, Faith. Uh-oh.
Oh, I was on mute, so.
Oh, okay. I was like, oh, it's mine too.
But Charles was in the middle of speaking, and then he got cut off. I don't know if his video went out or something.
Yeah, it looks like he got kicked off. His internet probably will come back on in two seconds.
Yeah. I loved what Charles was saying, though, is that, you know, it is so important for us to lift up these specifically Black women community-led organizations that understand the struggle, understand the fight, have that inner knowledge of what is going on. And when Charles comes back, I want him to be able to continue his point there. Until he gets back, though, I'm going to switch gears a little bit. Gabby, while you're here with us, I would love to hear more about going back to that notion of community. So we talked about the different resources, how to get involved. We talk about how to stay up to date with what 4Kira4Moms is doing. I want to talk about 4Kira4Moms coming on to the OHCEngage platform as an OHCEngage Plus member, and how you guys are planning to use the platform to amplify that messaging and create a community on the OHC platform that can really spread that message far and wide, but also be able to offer more resources to the community.
Yeah. Yes. So for OHCEngage, the reason why we chose this platform is because we do see it as an opportunity to grow a dynamic space for those who are interested and or in this space for maternal mortality and morbidity, healthy pregnancies, healthy children. The reality is we have a website, but a website is somewhat of a stagnant, you know, in today's day and age. And of course, we've got social media, but in social media, while we are competing with every day, oh my gosh, who's the new famous person, politics and all these things, what we wanted to do was have a platform for those who are actually interested and want to have dialogue and ways in which we can engage with them. So, you know, this is the first of many live conversations where we can also show more about the details of what we're doing, provide seminars, but really have an opportunity to link with other CBOs and like-minded community organizations, especially across the healthcare spectrum. Because the reality is the focus on maternal mortality is linked to so many other pieces of the healthcare structure. So whether we are talking to community-based health workers, doulas, and midwives, or OBGYNs, nursing students, nurses, everybody is involved in that. And then specifically students who are in healthcare, as they try to figure out where they want to go and navigate, we want them to understand that there is a huge space within maternal health, and it doesn't look like just traditional being an OBGYN anymore, but how important nurses are on the front line. So we really just see this as a place where we can engage with those who want to be a part of the fight and want to learn how to advocate, like yourself. So, you know, we can do trainings on here. But again, it's really just a dynamic space that we wanted to invest in and to help grow, specifically because it's for our community. And once you sign up, you're saying, hey, I want more information. I want to do more things in the space.
Wonderful. Thank you so much, Gabby, for sharing that. Charles, welcome back. Thank you so much. So I know you were in the middle of talking, and I wanted to make sure that we circled back around to you so you could finish up your thought.
Look, well, I don't know. I hope y'all remember what I was talking about. But bottom line, I think that, what was I talking about? I was so shocked, like my power just went out randomly and then clicked right back on. But you know,
You're
bottom
talking
line,
about community-led organizations.
yeah, community-based organizations, and making sure that we are prioritizing, elevating them, making sure that they're properly resourced, and creating pathways to success. It's a critically important part of how we fix this, a critically important part of our ecosystem, because also what happens, I'm just going to, you know, I'm transparent to a fault. What will happen is these large organizations will come in and observe, dissect the work that these community-based organizations are doing, and then take that and then roll that into their grant proposal to get the funding. I think we just need to disrupt the way that things have been done. And then for us as an organization, being able to be in the community, one of the things that I'm most proud of that we do is a lot of our community empowerment events. And so we do we're hoping to expand this to a series of events throughout the country. We do our marquee event is our Black Maternal Health Week block party in Atlanta during Black Maternal Health Week. This year it'll be April 12th. And to think about this huge festival celebrating all things birthing joy. And so what we do is we have live entertainment, we have free food, we have giveaways, we have the DJs, we have all this stuff out in the community at a park. People come out, have an amazing time. But while you're there, not only you get to soak up this amazing atmosphere, but you get to connect with the lactation specialists. You get to connect with the doulas. You get to connect with these organizations, with the food bank, with the postpartum depression support, right? You understand the people who are doing community outreach from our local hospitals that are serving. You know, we have innovators that have developed apps and technology platforms that are there demoing and, you know, allowing people, showing people how they can download and have these resources available in real time on the spot. So it's an amazing thing. We've expanded that. We've done that in New Orleans as well. We're looking to expand that into possibly 5 cities this year. But so us being in the community, touching the people, that will always be a priority and be at the forefront of what we hope to accomplish.
That is wonderful. I'm excited to hear that you're expanding that. Just going to throw it out there. Cleveland would love to have you. So before we move on to our Q&A, I see some questions coming in through the chat. I want to hear a little bit more about this block party. I want to know, like, where did the idea come from? Like, what? It sounds like it's a big event for a lot of people, and I just want to know, you know, like, I see everything, I hear everything that you've done so far with 4Kira4Moms and everything that you've been through. Why a block party? What was it about that?
There's a very deep, very kind of heavy backstory, but one of the things that I'll share, because I think we got to always speak truth to power, but I have a good friend, and he won't mind me sharing. His name is Greg Clay. And so Greg is an amazing leader. He's known Gabby and I for a while. He's a community servant. He and his wife lost a son very, very late in their pregnancy journey. It just so happened around that same time, there was a diaper company that reached out to me, and they said, hey, look, we have 3 pallets of diapers do you know somebody that can use them? I was like, hell yeah. I was like, ship them down to Atlanta. I'll figure it out. And as I was just thinking, just kind of like there was this kind of, God kind of put this thing on my heart to just reach out to Greg and check on him as a friend. It's like, how you doing? And I know he's always about serving the community. And I said, look, I have an idea. I don't know if you're at a point, if you and Shawnee are at a point of your grief journey that y'all are down for this. I was like, but I have all these diapers. I was like, why don't we just do a community diaper drive giveaway in honor of your son? He was like, yo, I love that. I had no idea at the time, as the universe would have it, maybe 2, maybe no more than 3 weeks. So we started kind of working and thinking about, we were kicking around. He's so humble. He didn't share this with me either. We were kicking around ideas around how we were going to pull this off, locations, and executing. 2 weeks later, Mayor Dickens announced Greg as the new commissioner of constituent services in the city of Atlanta. So he got this big position in leadership with the city of Atlanta. And I was like, yo, this is amazing. I said, Greg, I said, look, bro, I love you. I said, I think this is a great idea. I was like, but it's also a shame that in the city of Atlanta, which is the Black Mecca in the state, from those of you all who don't know, Georgia has the highest maternal death rates in the country, that the city has no premier event during Black Maternal Health Week. It's a shame. He's like, yo, you're right. And so literally this became his first project as head of constituent services. And so we did it last year. And, we did it in 2022, and it was awesome. 2024, we did it in 2023. I can't keep my years together. 2024, we came back and we expanded it. We partnered with Black Mamas Matter Alliance, and we incorporated their walk into the block party. We upped the entertainment. We had more vendors, more people, and it's just continuing to grow. So this year we're looking to take it to a whole nother level. And it's just a good time. So if anybody's in the Atlanta area or looking for something to do the weekend of April 12th, we specialize in hospitality. So come on down to Atlanta. It'll be a good time.
That is awesome. Where are you guys going to be having it in Atlanta?
So yeah, we're going to have it at, we are going to be having it at the Martin Luther King Rec Center, which is right smack down in Atlanta. It'll be free. It'll be a good time.
Awesome.
Yep. It's on that Saturday, and as Charles mentioned, we do hope to expand this year and actually include some workshops, possibly that Thursday or Friday, and then also working with OHC as well, in which we are going to launch a virtual arts and spoken word competition called Battle for Our Mamas. And so that same week, we will announce the winners, and those winners will participate on Saturday as well. So we are excited because, like Charles said, for Atlanta not to have a bunch of stuff in a marquee event during Black Maternal Health Week, it's only right that we do it, because actually it is founded in Kira Johnson's honor, because April 12th is Langston's birthday and April 13th is the day that she passed. So that is for us the weekend we always do something, and we'll continue. And our hope this year is that we actually grow out of the MLK Rec Center from a size standpoint. So please mark your calendars, April 12th, and stay tuned on OHC 4Kira Connect, as well as our website and social media, where we'll continue to put more information out there.
Thank you guys so much for sharing those details. I really appreciate the fact that, you took something that was a pallet of diapers and it turned into all of that. That is absolutely amazing. Just really quickly before we move on, how do events like this block party help to eradicate maternal mortality? How do they help to end our issues?
So 4Kira4Moms, we have a 3-tier strategy, and it's called educate, advocate, and legislate. And so this type of event, it helps in both educate and advocate, because number one, it brings awareness to the community about what's going on. But it does it in a way in which it's not focused on the death, because we believe in birthing joy. It's giving resources and inviting everybody to be a part of maternal health, which we kind of mentioned when I mentioned earlier, is it takes a village. The reality is maternal health and the fight for maternal health equity, it is not a women's rights issue. It is a fundamental human rights issue, which means everybody plays a role, and we need everybody in the fight for maternal health. Whether you are an expecting mother, you are a mother, you are a father, an aunt, a godmother. As Charles likes to say, there's only two types of people in this world. Either you are a mom or you got a mom. That's it. So it's important to all of us. And that's what events like this do, because it brings you into the conversation. It lets you know how you can help, which then now you know what you can do to advocate. By coming out on a Saturday afternoon, we've got a kids corner where kids can run around. We've got live entertainment. You can go around, talk to different CEOs and learn how you can advocate. This year we'll likely add something on legislate so we can have people sign up, because all of those three things, those are the three things that will help us to eradicate maternal mortality, because you got to know what's going on, you got to know what to do, and then you got to apply pressure. And that's the beginning of what we're doing at the Block Party. And I also mentioned, everybody is in this fight. And so another big program that we are focused on that we launched this year from a funding round, and we'll launch the first piece, is called 4Kira4Dads, Paternal Centers of Excellence. And that's because we do believe that fathers can be that first line of defense. If we bring fathers into the conversation and move it from a dyad, which has always been focused on the mother and child, as it rightfully should, but if you bring fathers into that, it becomes a triangle, a three-legged trilogy that will help to end, because men are making the decisions in healthcare. So how do we get our men to make those right decisions? How do we get men in the room to be that first watch of what's going on at the hospital? How do we make sure that they know how to be the first responder when you go home for postpartum, which is where a lot of deaths are occurring today? And so we have an entire platform and program that we're working on. It's going to be a virtual website and app that will be free to all fathers to take them through the 6 different phases using the sports theme. So pregame and warm up all the way to overtime, first quarter, second quarter, third, fourth trimester, which is postpartum, so that they are aware, because they are the ones who can see the warning signs that can be that first responder. So again, that goes into that educate and advocate category, and ultimately we'll go into legislate, because we do want to bring fathers in, bring them more into it. We did a Dad's Got Something to Say day in September on the 18th, where we went to Capitol Hill with 8 fathers across the birthing spectrum to go and demand to senators and congressmen to say support the Dads Matter Act and the Momnibus. We plan to do that again and hopefully take over Father's Day in DC. So again, being a part of the OHC community, you'll find out more. And if you've got any ideas or would like to volunteer, this is a great platform that you can let us know, and we'll eventually add more into that.
Thank you, Gabby. Thank you for going into that, and thank you for sharing that information about 4Kira4Dads. That was one of the questions that we actually had in the chat, and we're about to transition over to our Q&A. But it's wonderful to hear both of your personal stories and the inspiration that you are putting into everything that you do. Thank you guys so much for your dedication to what you're doing. Oh, look at that. That's cool. Yes, and oh wow, and the hearts too. Okay, see, I'm easily excitable. So thank you so much for those little pictures too. But your dedication to improving maternal health outcomes is commendable, and thank you so much. And to our audience, remember that one of us has a role to play in addressing this critical issue. And here are a couple ways we can get involved. So you can support 4Kira4Moms by going to their website, 4Kira4Moms.com. You can learn how to volunteer, opportunities, you can donate, you can participate in upcoming events and all that. And make sure that you're spreading awareness. Make sure that you go on OHCEngage and let those who were not able to join our live know about what we talked about here today, and also make sure you go on your other social channels as well. Before we wrap up, we're going to go into our Q&A, and as I said before, we did have a question about 4Kira4Dads, and Gabby, you got a chance to answer that for us. Those that are in the audience, please send us your questions now. I do see one question in here. How do we talk about maternal mortality or positive maternal health outcomes in the barbershop? How do we talk about it in the beauty salon? How do we do that? How do we bring those conversations to those places so that they can be amplified?
Yeah, like I think thank you so much. And I think, Silas, thank you for that question. I got excited when I saw that coming up in the chat. Here's the deal. We cannot underestimate, like, legislation is great, right? Grassroots movements are great. All these things we're working, so corporate responsibility is amazing. We cannot underestimate the value of just connectivity, human conversation, and interaction, right? And just having the conversations with people that are in your sphere, right? And it's something as simple, the way to bring this up, and the best way to bring this up and spark these conversations is, man, did y'all know that the United States is the most dangerous place in the world to deliver a baby? What? And then based on that, that sparks a conversation. Either people are going to say, yes, I know. I didn't know that, right? Then you can go into that and share your knowledge. Yes. And then you can go from there about the racial disparities. But this is what you can do. If you know somebody that's pregnant, ask questions. Tap into resources like 4Kira4Moms. For men, direct them to this. Man, 4Kira4Moms has an amazing platform. You can get all the information, tips, questions to ask, resources, free stuff, all by going to this app. It's like having, a birth advocate in your pocket, right? And encourage people to join and have the conversation. But the biggest thing, I think that that all communities, all people can do is just make sure that we're informed, right? Make sure that we're informed. If it's not tapping in with us, tap in with somebody. Make sure that people know. And we talked specifically about going back to this conversation with men. Gabby did an amazing job of laying out what this is and why it's so important. And our theory of change is just that, is that when, not if, but when we are able to empower a whole generation of fathers and fathers-to-be with these tools to be better advocates, to be better support systems before, during, and after birth, that will go a long way to what Gabby said about attacking that 84% of maternal deaths that are preventable and driving that number to zero. I want to be crystal clear. We are committed to driving and having a goal of zero preventable deaths from pregnancy and pregnancy-related complications by the year 2030. Is it aggressive? Absolutely, right? But if we don't set a goal and if we don't strive for it, then who's going to do it? Otherwise, people are going to just sit around, humming about it and admiring the problem. We're about actions, we're about solutions, and we're making sure that every family has the resources they need to not only survive, but thrive.
And I would also just add to that is, in our community specifically, right, it's talked the barbershops and hair shops, and it makes sense because historically there is a reason for us to fear hospitals and doctors. But at the same time, we got to use science, and we all are going to face ourselves, whether it's us, our parents, our children, somebody's going to the hospital at some point in time. And advocacy, when you are at that hospital, is so important. And that goes for maternal health, or even if you're going in there for anything else. And so if somebody is in there and just says, oh, my son, my daughter, my cousin is in the hospital for this, that's another way you can spark up the conversation to say, well, who's the advocate working with them? Do you have somebody there with them around the clock? Do you have somebody there with a notebook who's writing down, taking the doctor's names, the times, understanding access to the health records? Because once you have that, you're going to do the same thing when you do for maternal health as well. Because that advocacy, that's how you hold these providers accountable. There's a big difference if you have, when we all go to the hospital and you see, unfortunately, somebody who's there by themselves, and then you see the room next to them where they have people going out all day. I guarantee there's a different standard of care that those two patients are getting. And that's another way within our community is, hey, who is your advocate when you go to the hospital? And also, by the way, who's that advocate when you're going to celebrate your niece, your nephew, son, daughter being pregnant as well. And that's the role specifically that men can play. So, you know, gone are the days of where men are just in the waiting room with the stogie waiting. No, when everybody convenes at the hospital, man, you should have a support system there with you too. And they can advocate and they can be there and asking, hey, what can we do to make this easier for her and for him? But those are the ways to start. It really goes at pregnancy is for the mother and the father and the child. You can't have pregnancy with only one, right? And so the mother is important, but the father's got to be in service of the mother. So we've got to invite that father into the conversation as well.
Definitely. Thank you both for that. Those were great answers. We got a couple more questions in the chat. So I'm going to say this person's name, and I apologize if I say it wrong. I think it's Curly Palmer, and this is for Charles. What strategies can you share with fathers to help them advocate for the mother of their child when it comes to labor and delivery?
Yeah, so thank you for that question, Curly. So there's going to be an extensive set of resources and tools as a part of this curriculum, but I'll give you a couple of simple ones that are really easy to share. First one is understanding the expectation of your partner. Like, what is the birth plan? Because you can't advocate if you don't understand what the expectation is, right? What is it that you hope to understand? Now, all my doulas, all my midwives, all my clinicians, all my OBGYNs will tell you that birth plans don't always, seldomly go to plan, but you have to have a fundamental baseline about what the expectation is, because if you go in shrugging your shoulders, you're much more likely to be swayed or persuaded into an experience that may not be ideal for you, right? Secondarily, every hospital has what's called a patient's bill of rights. Some hospitals make it harder than others to identify those resources, but they're there, right? You can ask your healthcare provider. Some hospitals now are even taking it a step further and issuing what's called a birthing bill of rights. One of the things that I would encourage everyone to do is to, before you go into the hospital for your labor and delivery experience, find those resources, print them out, and when you check in, you'll see a board with your name, all that stuff posted on the wall in that room. Because what that document says, it says a lot without saying it. It says that this family is informed and aware of what their rights as a patient are, right? Then simple things, right? Because now there's a fundamental thing. And so you can understand if they are pressuring you, if they're persuading you, if they're doing things that are not consistent with that, you don't have to get irate. You can revert right back to your patient's bill of rights. It says that I have the right to informed consent. Informed consent means that you need to explain to me all of the options available to me along with their associated risks and potential outcomes, right? Something as simple as that, right? Also, I'm so glad you said it, Denise. I was just about to get to that. The NAAB has what's called a Black Birthing Bill of Rights. You can go on their website. If you can't find your hospitals or your birthing centers, you can go and utilize that one, right? Print that out, download that. Simple things as well as if you are being denied, if your service is being delayed, if you request a medication, if you request a procedure, one of the things that's very highly publicized about Serena Williams' story is that she kept on demanding a C-section because she knew her body. Not a C-section, I'm sorry. She kept on demanding a CAT scan, right? Because she knew she had experienced blood clots and she knew that this was what was going on. And they continually denied it. And it wasn't until her husband went out in the hall and made a big fuss and exercised his privilege as a white cis billionaire that she got what she was requesting. But if you are denied service, if you are denied treatment, and you feel that it's unjust, demand that they make a note of that in your chart and see how quickly they reconsider, right? Oh, okay, well, you're not going to give me the whatever. I need you to make a note of that in my chart, right? Because it lets them know that you are watching and that there's going to be a record of their unwillingness to give you the procedure that you felt was in need. So there's that, and there's a lot more. I think that, please download that birthing bill of rights. Then those are a great place to start.
Wow, I wish I would have known about that when I was having kids. Definitely a couple times I was like, why are you not giving me what I asked for? Now I'm having a baby. Thank
Yep,
you for sharing that, Charles.
sure.
Um, we had another question in the chat. Thank you, Curly. This one comes from Sam Clavel. Do you have tips or resources to help people educate themselves on these crucial topics that may not be readily talked about or shared on mainstream media?
Yes, so I think that one of the accessible ones, and Gabby, please feel free to chime in. I think that the CDC, so there's a couple of organizations that have a bunch of resources available around the data, around the outcomes. Even the March of Dimes each year releases a maternal health scorecard, and it talks about not only as a country, but state by state, how we are stacking up, how we are ranking. The CDC has extensive research on the maternal health crisis, the Black maternal health crisis, on their website. And there's a lot of other organizations like the National Association of Black Doulas that have a lot of resources as well. So those would be three that I would readily refer people to find out information and to kind of further your learning on this. But there will be a lot more resources and information and possibly some really exciting studies and publications that will be coming from us as an organization as well.
Yeah, we are working on coalescing all of that and putting it together for what we'll call the 4Kira pages and all that. So that'll be something we'll launch next year that we're working on.
Wonderful, wonderful. Thank you for that. I think I see one more question. So we've talked about a lot. You guys have given a lot of great advice on how to get involved. The question is, if we have any additional questions or comments, is there anywhere where we can leave feedback for you guys? Is there like a submission form or anything, or anywhere where anyone, or an email address that you'd like to share?
Yeah, so you can definitely go on our OHCEngage and make a comment there. But then you can also email us at info@4Kira4Moms.com if you've got any general feedback or questions that way.
Wonderful. And we just have a few more minutes here. So those were the questions that I saw in the chat. If I missed any, please definitely either connect with Charles and Gabby and the rest of the 4Kira4Moms team through OHCEngage, or I also put that email address, info@4Kira4Moms.com, in the chat. Just to wrap it up, I just wanted to say thank you again, guys, for spreading all of your wisdom, for sharing your information, for sharing your deep and personal stories with us. Everyone in the room really appreciates it. As a journalist, as I am, I really appreciate hearing your stories, and I love the storytelling that you shared. For our audience, this live session has been recorded, and it will be available for on-demand use viewing via OHCEngage and through OHC's YouTube channel, so be on the lookout for that soon. For more information on United States maternal mortality and OHC's partnership with 4Kira4Moms, you can follow OHC on social media. That's where you can stay connected with us for updates, additional resources, and future live events addressing critical health issues. Charles, Gabby, did you guys have any last words before we sign off?
No, thank you guys very much. We really do appreciate your support and participation. Please make sure to join us on our OHC page, 4Kira Connect, as well as look out. We are launching our holiday fundraising campaign, so you'll see some stuff next week for that. And if there's any ways that we'd like, and hopefully we'll be able to get everybody's information, but we'll reach out as well as we put together our list of resources. And if you've got any ideas on collaboration, please do reach out to us as well.
Yeah, I just want to just kind of echo Gabby's sentiments. Thank you so much. Thank you, just Faith, for being a wonderful host. Thank you to the community, everybody that's joining. Thank you for those of y'all who shared these resources in the chat. I want to shout out one very important thing that Leslie shared, which is, the standards of respectful care in the state of New York. In NYC, which was huge. For those of y'all who may not be aware, New York, particularly in certain boroughs, had some of the most egregious birthing disparities in the country. And one of the things that the city did was to basically put out a standard of respectful care across the board. And so I'm really glad that she shared that. That's another great resource. And we're really hoping that other cities will kind of link arms to make sure providers. I just wanted to kind of point that resource out to folks, but just grateful, looking forward to continuing to build and support this community. We're looking forward to, we'll see y'all soon.
Thank you so much, Charles. Thank you, Gabby. I'm just going to reiterate one thing that Gabby said: educate, advocate, and legislate. Thank you, everyone, and have a wonderful day.
Thanks, everybody.
Thanks, everyone.